The Fan.
It is 9:45 on this Week 4 edition of Football Sunday. Malusis and Jones with you. Let's welcome aboard right now Dr. Brandon Erickson, Rothman Orthopedics. Injury report brought to you by the great people over at Rothman Orthopedics. Good morning, Doc. How are you?
Doing well. I got to give your Orange quite the shout-out yesterday. I didn't think they would cover a 50-point spread, but wow. Geez.
I'm having flashbacks to the days of Donovan McNabb. I really am.
Sure.
The glory days of Paul Pasqualoni. Doc, I'll tell you, let's start here. Tua and the Miami Dolphins. Scary scene on Thursday night against the Cincinnati Bengals, where he was obviously knocked out cold, taken to the University of Cincinnati Medical Center. Reportedly, the thought is, the previous week suffered some sort of a head injury against the Buffalo Bills. They claimed it was a back injury. The doctor that went through it during halftime has since been fired down there. So take us through what you witnessed, what you saw, and now Tua here, who's in the concussion protocol, and there's no timeline, obviously, for his return as we speak.
Yeah, I think first and foremost, it's pretty fortunate that he's doing so well. He flew home with the team, which indicates that he didn't need to be, kept in the hospital overnight, which is pretty impressive considering what we saw. So let's track it back to the Bills game. So obviously everybody saw him go down. They saw him try to stand up and kind of wobbled around a little bit, fell back down, had to get help to his feet. And so appropriately, he was taken out of the game. And so at that point, there's a whole lot of things that go into play. There's kind of an independent neurologic consultant that's at all of these games. Basically, it's a neurosurgeon or a neurologist, somebody very familiar with brain injuries. And so they have to be evaluated by both the team doctor and then this independent consultant. And the independent consultant actually has final say of whether or not the player can go back into the game. So they put them through a battery of tests, and then they also review the film, right? Because we see sometimes where, somebody doesn't even look like they have a concussion, and then the refs get buzzed down and somebody gets pulled out because they were watching the video. So that's part of it too. And so apparently, I guess Tua cleared the game day questionnaire and the game day return to sport test that allowed him to go back. I'm a little surprised on that because part of being allowed to go back means that the video didn't look like he was stumbling or lost consciousness or anything. So to me, I probably would not have allowed him to go back in that game. Now, he finished the game fine, but there's always the risk that he gets a second hit, and that becomes a real problem. But the other issue was then he was examined after the game, and he was not put into the concussion protocol. So he had, he took this test that guys take afterwards to determine if they have a concussion. They had a neurologic exam, et cetera, and I guess he cleared that as well. So then he had a short week of practice, came back out and played on Thursday, and we all saw the hit that he took. And then he had a very, very scary posture that his hands went into. And I know some people may not have, looked at that and said, well, that kind of looks funny. It kind of looks strange. But that's pretty indicative of a potentially very significant brain and brainstem injury to the point where you wind up with second impact syndrome. You are non-functional because what can happen is when you get a second hit to the head and the brain starts to swell. If you think of let's say you and I got into a fight, I punched you in the arm, your arm swelled up, got a big bruise on it, right? No big deal, right? Arm swells up, bruise goes down in a week or two, not going to have a big issue. Your brain, if you think about the same thing, if the brain gets jarred and it winds up starting to swell, it can't swell past your skull. There's only a little bit of room for the brain to swell. So what can happen is as the brain tries to swell, the skull doesn't allow it to expand, and it can cause significant damage to the nerves because they're getting squished by all of this inflammation. And that's why sometimes in this second hit syndrome, you see people that have to have part of their skull taken off to let the brain swell, and it can be a huge disaster. So, thank God Tua is okay. I think they're going to review this. As you said, the independent neurologic consultant was let go probably because Tua should have been held out after the Bills game and should have been put into concussion protocol. So we're gonna find out a lot more, and then we'll see what Tua has to say when he speaks to the media this week.
Doc, it's Kim. I got two for you. When you mention, and you're obviously right about this, that it's the independent consultant, the independent neurologic consultant who makes the final decision. Why not make that a joint decision with not only the independent person, but also the team doctor, so that there's ownership by two people with that decision, one of whom presumably knows the player as part of the team, the other who's the independent party. Why not make that both medical people, most highly skilled medical people, both of them making that decision?
Yeah, I think that's a good point. And I think the team doctor does have some input. or at least I hope they would. The reason that, as you know, the independent consultant is there for both teams, so there's no question of one team holding another player out on a different team because of any issues. So that's their role. But I totally agree with you. It should be a joint decision with the consultant having the final say. I don't know how much input the Miami team doctor had into allowing him to go back. And my hope is that if he said, listen, you probably shouldn't allow him to go back, the consultant wouldn't overrule him to let him go back in. Usually it would be the other way where the doctor says, he might be okay, and the consultant says, no, we got to err on the side of caution.
Right.
I think what we're going to probably see out of this is people erring more on the side of caution than anything else, which I think is the right move.
And my follow-up to that is, do you think that there's going to be any consideration about perhaps an observation period where a player does look woozy? And one thing that we've seen is teammates really pointing to those players at different times to make sure that the sideline sees it, because, we've had cases where the sideline doesn't, or, quote unquote, doesn't see it. But we had Tua walking off the other day, and the kind of sort of collapse type of thing, which was very uncomfortable to see and to think about him experiencing. But maybe an observation period where these guys get every chance to be healthy when they return, as opposed to playing 4 days later and somehow being in that darn game.
Yeah, I think you're exactly right. And I think that the problem probably stems from him not getting put into the concussion protocol at all, because once they get put into the protocol, then there's a 5-step phase that they have to pass. So there's 5 steps that they have to go through. They basically have to have no symptoms at the start, to your point of the observation. So they have to be completely symptom-free before they start to even exercise. So they can't have any sensitivity to light. They can't have any headaches. And that can take a day, but that can also take a couple of weeks for you to be completely symptom-free. You saw Hunter Renfrow had to miss a game because of the concussion protocol that he had a few weeks ago. So that's exactly right, Kim. So they do that observation period. It was just the problem of not putting him into the protocol to basically get him into that 5-step period to get him back. I think that was really the crux of the problem.
Yeah, and it just brings that, what we saw on the field, why wasn't that enough for him to go into the protocol, Doc?
Yeah, I most honestly, it's always easy to, hindsight 2020, but I'm 100% with you. I think he should have been put into it.
He's shaking his head. He's having trouble walking.
Exactly.
And clearly his legs, he looks like a fighter that just took one in the 10th round. How is that not then enough to say, there's an issue here, you're going into the protocol?
Yeah, you're exactly right, because part of the NFLPA kind of checklist, the game day checklist, literally one of the checkpoints is video review. So let's say he passes everything else. He's got he can recall everything. His mental state is fine. He's completely strength intact, motor intact. But you saw the video. You saw him fall. So that's one of the checkpoints in allowing them to go back the same day, let alone putting him into the protocol at all. So I'm with you. I think based on the video, and I think that's probably why this independent neurologist was let go, because when you see somebody stumble like that, I don't care what they said about his back and things like that, but there's no way that you fall down and look wobbly from a back injury.
Doc, we could do probably half an hour on this and not run out of questions on this topic alone, but let's just get, for our audience's sake, let's talk about Zach Wilson back today. After that knee procedure, after a timetable that was ridiculous to start, and then it became a much longer timetable. We've discussed that on a previous show. But where do you expect Zach to be as a football player today, coming off that surgery and that situation?
So I think, from a knee perspective, he'll probably be as healthy as he's going to be on that knee, right? He had his surgery. He had a good amount of time to recover. This is an appropriate time for him to come back. The problem with the knee is that, he has this old PCL injury. He's had part of his meniscus taken out. So now this is kind of a, quote, knee at risk. So we just have to see how this knee holds up, over the season and over the course of his career, however long that is, because this knee could be something that causes him problems down the road. Now, he may be totally fine, but I would be very, very hesitant to allow him to run as much as he may have run, prior to his PCL and his meniscus injury, because we know that knee could potentially be a problem down the road. And, what I'll tell you is, we've talked about this before about guys coming off of the surgery and injury. Oftentimes it takes them some period of time to feel comfortable again and get back into the swing of things. So I would expect him to be pretty hesitant today, similar to what we saw from Saquon last year to this year. Now, meniscus is a big, not as big of a deal as an ACL, but still it takes guys some time to get in the flow of the game. So I'd expect him to have a rocky couple of games.
I want to ask you, Doc, one about Sterling Shepard, because there's been opponents that have come to MetLife Stadium talking about the turf being tight. And there have been complaints about it. The 49ers complained about it. A number of teams have complained about it. Monday night, you see Shepard slowing down, end of the game, not even in a full run, and grabs his knee, goes down in pain, tears his ACL, coming back from the ruptured Achilles. Number one, to come back from both of those injuries in back-to-back years and what you saw from that non-contact knee injury from Shep on Monday night.
Yeah, I mean, usually ACLs, as you know, are usually non-contact, but you're right. It was towards the end of the game. He didn't look like it's like you said, he wasn't in a full sprint. What I will say is towards the end of the game, guys start to fatigue a little bit. So some of the supporting muscles around the knee that help keep the ligaments healthy, like the quad and things, they tend to tire out towards the end of the game. And so when you're, last minute or two of the game and you've been pushing it pretty hard, you are definitely at a slightly higher risk of having an injury than in the first quarter. That being said, we saw last year, like you said, with the 49ers, and they came in 2 guys toward their ACL, right off the bat last year. We haven't seen that as much this year, but I do think that turf definitely plays a role into it. And I know they've looked into that, and they've looked into injuries and things, and they've concluded that it's, not anything that increases guys' risk of having an injury. But it does make it a little bit concerning when you see how many people have torn their ACL at that particular stadium. And to your other point of getting back from the Achilles and the ACL, I mean, I feel terrible for him because it's very difficult to come back from an Achilles. That's one of the hardest injuries for explosive players to come back from, and he did. And then to tack on an ACL on top of it and lose another year to the ACL, listen, we'll see how he recovers and comes back. He looks fine from his Achilles this year when he was back, so I hope that does not linger long term for him. But it's just it's a long time to be out. It's a long time to not be in football shape, so we'll see how he does next year.
When Doc, from your perspective, because you've worked on the college level, and you have a vast amount of experience, when a coach talks about a field being tight, right? We've heard people complain about, the Chiefs complained about Arizona being loose. A number of guys suffered hamstring injuries that opening week because they put down new sod. When a coach is complaining about a field being tight, how does that affect the NFL player?
Yeah. So I'll equate it back to, Notre Dame back when I was there, and we let the grass grow a little bit to slow down Reggie Bush, right? So when you let the grass grow a little bit and it's nice and soft, you don't
– a field being tight, how does that affect the NFL player?
Yeah. So I'll equate it back to, Notre Dame back when I was there, and we let the grass grow a little bit to slow down Reggie Bush, right? So when you let the grass grow a little bit and it's nice and soft, you don't have as much spring off of your step, so it slows everybody down. And it's a little more it tends to be a little bit more effective in the faster players because they're so much faster to begin with. So when a field is a little bit looser, it's spongier, it has more give to it, it doesn't allow guys to explode off of it as much. When a field is, like you said, tight or a little bit firmer, the speed at which the game is played goes up by a good amount, and it's also not as forgiving. So if you think about the ground as being able to absorb some of the stress that comes from hits and pivoting and things, the tighter or the harder the ground is, the less stress that the ground is going to absorb. And so the more stress that goes through that player's joints. It's like if you went for a sprint on a football field versus going for a sprint on a track, you're much faster on the track than you are on the football field. And that's kind of the same idea.
Doc, you're great. We appreciate it. Enjoy all the Week 4 Sunday action. Well, we're actually off next week because we got the Giants game.
The London game.
Game. Yeah. So, but we'll talk to you in a couple weeks. All right, Doc?
Sounds good. Listen, have a great week. And Kim, we never discussed your infatuation with squirrels and the people calling in about that. At some point, we're going to have to talk about the squirrel stuff. I don't know when you want to bring that up. We'll get into that at some point.
Whenever you have time, Doc, I can talk squirrels with you. I promise.
Doc, you're the best.
Sounds
we
good.
love you. Have a good week, and we'll talk to you in a couple of weeks. Dr. Brendan Erickson. Take care. I didn't know we were going to go to squirrels.
I didn't know where we were going there.
No,
we could have gone a couple different ways there. The Doc actually surprised me. That was not on my top 10 of where he was headed with the question for me, I'll tell you that.
His injury report brought to you by Rothman Orthopedics. It's Malusis and Jones with you. Straight ahead, Ken Barkley will join us, get his thoughts on the Week 4 Sunday slate that will be already a game underway overseas. We'll get into that as well. It's Malusis and Jones, the Fan in New York.
Hey guys, how would you like a chance to be the next New York Giants junior reporter? Presented by Wendy's. The grand prize winner will interview a Giants player, receive on